top of the hour. In an effort to combat our nation's opioid epidemic, attention has been focused on stopping the flow of pain medications to people who might end up abusing them or addicted to them. But has the pendulum swung too far? Are we overcorrecting? In 2016, the CDC issued new guidelines for doctors to cut back on painkiller prescriptions, leaving many patients fighting to get the medication they need. They're in a lot of pain.
That was a big problem. Meanwhile, just last month, the Centers for Disease Control clarified their position, saying their response went too far. But will the revised policy bring pain patients relief? Dr. Sally Sattel is a psychiatrist at a DC methadone clinic and author of PCMD, How Political Correctness is Corrupting Medicine. Dr. Sattel sent an open letter to the CDC to clarify their position back in March. She joins us live right now. Good morning to you, Doctor.
Hello.
It was quite a mess back in 2016 because the CDC essentially said there's a crisis with opioids, you got to cut back, but for people who are in a lot of pain, didn't help them.
Well, yes, they issued their guideline in 2016. It was on chronic pain, and it was for primary care doctors. And to be fair to the CDC, their guidelines were not bad. They urged caution, and they urged a weighing of cost and benefit. What was unfortunate is that some doctors and healthcare systems and insurers and states and state medical boards, they tended to misinterpret those guidelines as a mandate to decrease dosing, especially again in chronic patients, people with intractable pain who've been on these medications for years, sometimes decades, and doing well. And the guideline was interpreted as a mandate to either decrease those doses to below a threshold that was intolerable for some because their pain reemerged, or to discontinue altogether. And it was and still is a disaster for so many people in chronic pain. And that's why we wrote the letter. I wrote the letter with a number of colleagues, and to the credit of the CDC, they did issue a letter to us clarifying their intent, which was we want no one to be forced off their medications, no one to be taken off without their consent, assuming it's working well. And then 2 weeks later, they published the same basic message in the New England Journal of Medicine. So they did a lot, but that wasn't enough.
Right. So now we have patients who come in with chronic pain and need them, but doctors are concerned because things could end up in a lawsuit. They're not really sure where this is heading. So overall, doctor, do you feel we overcorrected?
Oh, I definitely feel we overcorrected in this regard. What doctors now are afraid of, because we published those letters, we put them online, we wanted patients to take them to their doctors and say, see, it's okay for you to keep me on these medications since I'm doing well. And now many of the doctors are afraid of the DEA, the Drug Enforcement Agency, and also CMS sometimes won't cover it, and again, state agencies. So there's still a lot of misconceptions. And yes, we had to cut back on prescribing. There's no question that too many doctors were a little too liberal. They had a low threshold for prescribing, and for acute pain especially. This is pain, you know, if you break your ankle or something. They'd give too much at a time. It would end up in medicine chests and then flow out into the, all that needed correction, but we've gone too far.
Yeah, there was no balance. So have you heard from patients who needed the stronger drugs, and now they're getting them again after this correction or clarification?
Well, we've only heard from the people who didn't succeed, unfortunately, with their doctors, and it's really it's desperate. We get my colleagues and I get at least 10 letters between us a day, heart-wrenching, and one of our group is keeping a registry of people who've killed themselves.
And Dr. Leslie, real quick, do you believe the pharmaceutical companies actually got us started on this mess and the addiction morass that we're in right now?
They're part of a very complex equation. I would not say they're the sole cause.
All right. Dr. Sally Sattel joining us from our nation's capital, where they're trying to make it clear about what sort of drugs people should be prescribed. Doctor, thank you very much.
Thank you.
All right.